Hi, this is Will from Chiropractic. Today we're going to go over some tips and hints for self-release and rehab for conditions like hip pain, hip bursitis, if you've got early stages, hip degeneration changes. Some of these things can also start to influence and contribute towards lower back pain as well as different types of leg pain and tension, or even knee pain can be developed with problems associated with the hip. So first we're going to go over some lengthening exercises and some release exercises using a tennis ball or a massage ball, depending on what you can take firmness wise. The key muscles associated that we want to release that become tight or tense, often your hip flexor, your psoas or iliacus, part of your quad, the outer part of the thigh called the iliotibial band or IT band, part of the glute, so gluteus medius, minimus around the side. Those are the areas that we want to target first and release. They can be pretty tight, very sensitive tissue to begin with, so you're going to have to persevere and use some ice afterwards if it's quite sensitive. In some instances you can actually make it feel quite bruised for a number of days. If this occurs, next time you do it, just be a bit more gentle, okay? So, lying on your side, I'm going to start with the IT band. Now, the bony bit on the side of the femur, that's called your trochanter. Don't press onto that, that'll be really sore. But go below, go above, go in front of, go behind. So I'm going to start on the IT band below. We're just going to press into the ball. Now the beauty of this is you can gauge the weight and pressure yourself. So if I put more pressure on, it's going to hurt more, but it's going to release quicker. But I can, if I just prop myself up, I can take the pressure off, back it back on. If you've hit a real sensitive spot that causes a fair amount of radiating pain, you're probably on a pressure point, a trigger point there, so just keep some pressure on that until it disperses. That can take around 30 seconds. And then move on to another area, so a bit lower down on the IT band. And just press into there. You can use a foam roller, but I quite like the more specific pinpoint pressure with a ball rather than rolling up and down. I find that a bit more effective at times. That's quite a hot spot. So if you want to move on to the quad, you can go onto the quad again. You can use a foam roller, find those little tense spots. A quad muscle does need a bit of a firm ball, a tennis ball. You might just sink into it too much. If you do hit a tight spot, again, wait for it to disperse. You can even lengthen the muscle by flexing the knee. This is going to lengthen the quadricep and actually do some release type action. So just spend a bit of time there. If you want to come onto the glute, so go ahead and come around the back of that bony bit, the trochanter, use that as a reference. Come around, you'll often know where your painful bits are and you can concentrate on that. And again, just press in, spend a few minutes, 30 seconds, 60 seconds, depending on how sore or active the areas are. You can just spend a few minutes releasing the area. Now, to stretch your hip flexor, you can use a ball to self-massage hip flexor, but obviously it's quite a delicate, sensitive area, so I tend to just focus on stretching it. So a lot of people will stretch like this. You know what? You don't need to. Go into a slight lunge posture, nice and straight. Now this area, what we're going to do is I'm just going to clench my glute on that same side, and at the same time I'm going to try and flatten my lower back. That's arched. I'm going to try and flatten my lower back, keep straight. Clench the muscle, the glute, squeeze the glute, just drive the hips forwards until you feel that tension develop there, and hold that for 10, 20, 30 seconds. Some people, if you're really supple, might just need a bit more of a slight lunge action, but if you get it correct, if you stay tall, if you flatten your lower back, you can contract the glute, you'll get that stretch quite quickly. If you haven't got too much hip arthritis, you can gently stretch the inner thigh. If you have got quite a lot of hip arthritis, it's not going to like this position too much. Again, just stretch the inner thigh, try and squeeze the glute, and you'll just get a bit of hip flexion as well as real upper insertion, adductor stretch occurring. Right, so next we're going to move on to rehab. Often it's a glute problem with things like hip bursitis, or if you've developed degeneration of the hip. In the absence of trauma, you've probably got a glute problem. Normally a weakness with gluteus maximus, which is that sort of lockout hip extension, or that's hip extension. There's normally a weakness there. Often you'll have a weakness with either piriformis, which is an external rotator, or gluteus medius minimus, a hip abductor. And it's a dead simple way of finding this out. So if we're going to start with the smaller muscles, gluteus medius, minimus, piriformis. If you go on your side, you can work out where your weakness is just by how strong it is. So I'm going to keep my toe face down, and I'm going to elevate the leg, abduct the leg. I'm going to hold that for just pause, and then back down. And we're going to do repetitions. And by repetitions, I mean literally 15 to 20 repetitions. Now, if it's really weak, by about 8 to 10 reps, you're going to probably start to feel it cramp, or it just won't want to lift. If you compare it to the other side, you'll find out where the weaknesses are, which one's good, which one's normal, and which one's abnormal. So again, the same posture, just toe down, elevate your leg, pause, back down, and do reps, and you'll find out where the weakness is. So one side will be fairly straightforward, the other side is going to be quite difficult. There's your weakness. Moving on to piriformis, an external rotator. So again, we just have the hip slightly flexed, and we're just going to rotate the hip out, the leg out, externally rotate, again that pause, and just feel the muscle work, feel the muscle contract. And again, it's reps. So if you get to 8 reps and it's starting to fatigue, or it's getting painful, it's getting difficult, there's your weakness. There's your muscle weakness. So this is an external rotator, piriformis. Again, compare both sides. So you're just going to rotate out and pause. One side will be easier, one side will be difficult. The difficult side is the weakness, and that's the one that needs to be built up. And again, this pause is critical because it helps the muscle to contract. Stops you cheating, so rather than using momentum. The next one is your glute max, and again that's a hip extension. You can do a typical bridge, and the focus is on squeezing the glutes and holding it for a few seconds and then back down. Now, if this hurts your lower back, or if you feel it more in your quads, the glutes aren't doing what they're supposed to be doing, and in that instance we can make it a bit easier by doing a type of thruster. Here I'm just going to use a ball. You can use a chair, that's more stable, but we're just going to go onto the middle back, and we're going to lift the hips, and we squeeze the glutes. Often it takes the lower back out of the problem here, and takes less load off the quads, so we can really focus on engaging and squeezing the glute max, the hip extensor. And again, we're doing reps, so we want 10, 15, 20 reps, and if you feel a weakness, that's where the problem is. Right, give that a go, and once it becomes easy, we can then apply an additional load by starting to band those movements. But to begin with, you should be doing 15 to 20 paused reps. And once that becomes fairly straightforward, and you can do 3 or 4 rounds, 3 or 4 sets of that, then we can use on applying a load and using some band on the legs. Okay, if you get any problems, please get in touch.